it another minute and a half or so, and then we'll get started. Yes. Okay, it looks like lots of folks are logging on. So we can just go ahead and get started. Hi, everyone. Just to let you know, we are going to go ahead and record this webinar, recognizing not everybody can join us today and that this might also be helpful reference in the future. So we're going to go ahead and record it. It'll take a few weeks, a couple weeks before we have it posted online because we're going to ensure that there's some closed captioning available to the recording. So let's go ahead and get that started. Okay, well, welcome again. My name is Chris Edens. I'm the Chief Deputy Director for Program Services here at the Department of State Hospitals, and I am joined by Julie Mallory, our Growth Cap Program Manager. We're going to be sort of tag teaming on this today. We really appreciate you joining us for a review of the Growth Cap Expenditure Plan. We also have, we're also touching on some frequently asked questions that we commonly receive. And so hopefully you'll find this webinar helpful to you today. Before we get started, I just want to first acknowledge that we did have a technical snafu. I think that comes par for the course for Growth Cap. We have experienced multiple snafus in the past. So we experienced a little snafu with the initial setup of the calendar appointment for this webinar, where many of you may have encountered a block from registration. So just wanted to apologize for that. We did fix it last week, but we had to send a new link as a result of fixing that item. So again, apologies for that, and we will always strive to do better next time. Just a few housekeeping items. As I mentioned, this presentation is going to be recorded. The slideshow and the presentation is going to be posted online to our Department of State Hospitals Growth Cap webpage. We will send an email out once the recording's been posted. Shortly after this presentation, we will package the slides up in a PDF format as well and email it out to everybody so you can have that for almost immediate reference. And then also a few other housekeeping items. Each person that's joined has been muted. And so we're going to try to allow for questions, time permitting. So encourage you to just use the chat function to drop in questions as you're thinking of questions. There's also a Q&A function. I have both of those up, so we'll try to monitor that. And like I said, if we can weave in responses where it makes sense to do so, we'll try to do that. If not, if we have time at the end, we'll try to answer some questions. And if we just run out of time completely, we definitely will, like I said, have this webinar recording made available, and then we'll also draft a frequently asked questions document that we can then release for the benefit of everyone, those who are here with us today and those who may not be able to join us. So let's just go ahead and get started. So our agenda for today, we're going to touch on provide just very high level policy overview and process timeline to kind of get us oriented as to what is the expenditure plan and where is it in the process. Again, mentioning that we have some frequently asked questions. This is really kind of going through some of the key policy components and questions that have come about as a result of that. and then we will dive into our expenditure plan, and then we'll wrap up. So just very high level, I always like to frame us with what are the goals of the IST growth cap. The first really being that the growth cap is to help guard against unintended consequences of the historical level of investments that have been made in DSH funded community IST services. To encourage efforts at the county level to reduce arrests and rearrests of individuals with serious mental illness, and ultimately mitigate the continued growth in the creation of more incompetent to stand trial individuals, not just those committed to the Department of State Hospitals. And lastly, to encourage participation in our DSH funded programs, particularly community IST programs such as diversion. Again, super high level overview, just wanting to touch on some main points about the growth cap program, especially for those that might be a little new to this process, is that the growth cap was established in Welfare and Institutions Code section 4336 and is actually effective this fiscal year. The growth cap sets fiscal year 21-22 as the baseline year for a county's total annual felony IST determination count. So when we talk about the baseline, we're really referring to what was the IST count back in fiscal year 21-22. Annually thereafter, a county may be charged a fee, a penalty, if IST determination counts exceed the county's original baseline level, and that fee would be based on a tiered rate schedule. And also just to touch on, I don't have it here in the slide, but in terms of payment for that fee, any local funding source may be used to make the payment. And or if a county participates in and has a contract with the Department of State Hospitals for IST services, and you may have some savings associated with that particular contract program, those savings could also be applied towards the payment of the penalty. Essentially, we just offset it. And any funds that are collected from counties who are subject to these fees, 100% of those funds are returned to the county for reinvestment in different activities that are outlined in the statute. And those activities really are centered around upstream or re-entry efforts to prevent that arrest, rearrest of those with serious mental illness. And for more information, detailed information, our growth cap documents, copies of all the data reports that have been shared with all the counties, those are available on our growth cap webpage. So just to touch a little bit on the process timeline, and again, this is to orient ourselves as to where in the process is the expenditure plan and when that is required. At the end of October every year, the department issues a final report on your county's IST determination count for that prior fiscal year. During the actual year that we are issuing the report for, we also issue quarterly progress reports, and that represents unreconciled data, but it is a report that is intended to help provide some additional information and to help you with tracking trends of the different of your IST determination count throughout that year, so that you can monitor and recognize when the trends may be going higher than your baseline. Between November and January, we have what we call a dispute window. So while we do our best to validate every IST determination that we receive in the department, there may be times in which we are missing information. A really just easy example is if there was someone on the wait list who had actually passed away before we had admitted that individual, and we were not informed that they were passed away. So during this dispute window, counties have the opportunity to provide additional information to address any discrepancies in the count. Then from February to April, that's our window, the department's window to review the information, to validate the information, and then provide a response that may adjust that final determination count for the prior year. And then this year, we are anticipating that by the end of this month, we'll be prepared to issue invoices to counties who are impacted by the growth cap. At this point, we are tracking about 11 counties who may be subject to the growth cap fees. Here's the timeline continued, which is really more focused on the invoicing and expenditure plans of the process. Starting on the top left in the blue box, as noted on the prior slide, we anticipate sending invoices to impacted counties by the end of this month. That is an estimate, could spill into early June. From there, the county is expected to make the payment within 90 days. And for this year, that would be by August. We then deposit those funds. Once we receive the funds, we deposit the funds into what is known as the Mental Health Diversion Fund, which is established at the State Controller's Office. During this time, the county then submits their expenditure plan to the department. We encourage that plan is submitted as early as possible. You don't have to wait to provide that expenditure plan at the time that you are making payment. We would encourage that can come up to us, the earlier the better. And we'll dive into that in a little bit more detail later on in this presentation. After the expenditure plan is received by the department, and we take a look at it, there is an approval process. I put that in air quotes because it's not a rigorous approval process. It's got to check off some boxes. But then once we approve it, then we will issue payment back to counties within 45 days of approval of that plan. And then county basically works to spend the funds in accordance with your expenditure plan. And we'll touch on this a little bit later, but I did want to acknowledge at this point that the spend down of funds can be over multiple years. Whatever you receive back from us in terms of the growth cap reimbursement does not need to be spent down in that same year in which you receive it. And then we'll also talk about this. There'll be a future sort of information letter as well as webinar available, but there is another report, not to try to confuse it with this expenditure plan, but there is an annual expenditure report that would reflect your actual expenditures applied to the plan that you've developed in accordance and in response to the statute. And that's due annually in October. Okay, so I'm going to go ahead at this point and just hand it over to Julie, who will walk you through some of the key elements of the growth cap policy guidance and frequently asked questions.
Thank you, Chris, and thank you everyone for joining us today. We're glad you can be here. My name's Julie Mallory. As Chris mentioned, I'm the Growth Cap Program Manager. In this section, it's really focused around some of the frequently asked questions that have come in either to our email box or through conversations we've had with the counties. Most importantly, I hope that it provides you with valuable resources. So, some things that you can refer back to so that if you're having some questions down the line, you know right where to find the information as we move through the years. We can go to the next slide. So starting with the largest one, and we'll kind of crosswalk quickly through some of the attachments here, is where can I find the policy? So we refer to our webpage a lot. I wanted to take a minute just to call out Department Letter 23-003. It is the policy that operationalizes the Growth Cap program. I know we get a lot of confusion because we refer to it as a policy. Formally, it's called Department Letter. That is our policy. It can be found by visiting dsh.ca.gov. When you visit that site, you're going to come to a landing page, and there's a clip of it on the right-hand side of your screen in that red box there. The landing page is going to look like that. And then circled in red, the Growth Cap page is, you can access it by clicking the blue link that's circled in red there. All of the resources that we cover today are going to be able to be found on that Growth Cap page. So hopping back to the policy specifically, Department Letter 23-003, it has attachments that accompany it, and each one is lettered A through F. So all of those attachments are broken out. And the reason we did it like that is to make it easier to find, so that if you're looking for your baseline data or you want information about the dispute process, you can jump right to it without having to thumb through pages of information. So hopefully you find it user friendly. We can hop to the next one. So hopping into attachment A, I'm going to hop onto each of the attachments just briefly to cover them, but I want to focus in on attachment A because our biggest question here is what is our baseline from the counties? So attachment A is the fiscal year 2021-22 baseline data. It is the baseline for that fiscal year and all subsequent fiscal years. On the far left-hand side of that sheet, and I know it's tiny here, we tried to put it in for reference so you could see it, but you can access a larger version on our website. On the far left-hand side of the report, the second column there after the county name is going to display the initial count. That initial count is just the total number of referrals that DSH has received. And as you move to the right, you'll see a dark outlined box, and that black box displays all of the commitments that have been removed from the count. Each removal category there has a description that ties to it. And those descriptions for the categories are defined more in our attachment C, which is called our IST determination methodology. And it explains how that criteria is applied. The another bout of frequent questions we get asked with this data is what's the exclusionary criteria? So the answers are the determinations are based on the commitment order date to DSH or a DSH funded program in a given fiscal year. And the exclusionary criteria, as I just mentioned, can be found in more detail in attachment C. Looking again at the data report there, the final baseline numbers, what is considered final for the department, can always be found on the far right-hand side of the document, and it's highlighted here in red. That box is going to take into account all the exclusions and any diversion credits that are applied. We can go ahead and hop forward there to the next slide. This is attachment B. Attachment B is what was released when the policy was released. So it's entitled Fiscal Year 2022-23 Unreconciled Data. All of our data reports are released in this format to try to make it easy to follow. You can see at the upper left-hand side of this document, you'll see red text there. We call out that this is an unreconciled report. It's what the department refers to as progress reports, meaning that the data has not been finalized yet. DSH shares these progress reports to the counties 60 days following the end of a quarter to allow the counties to track their determinations in more real time. So counties receive this unreconciled report 4 times a year. The final report for any given fiscal year are released once a year, so once annually, and that release is made at the end of October, as Chris was sharing in her previous slide. So since the release of this attachment, it has been updated to become a final report, and that final report, there's a link provided on this slide for reference for when we share the slides out, but you can also find the final report of attachment B on our website, dsh.ca.gov.
Julie, before we move on to the next slide for yourself, I want to acknowledge as I am viewing these slides in the past, and you may have this very question as you're listening to the presentation, is that we use the term IST determination, IST commitment, IST referral. In this context, we sort of use them all interchangeably. So I just want to acknowledge that if you see some of that terminology, but overarching, we're trying to consistently utilize IST determination, which is defined in our methodology and available in the policy. And so for those that may be interested, want to know more about what is a determination from the context of DSH, that's going to be outlined in our policy and our methodology for how we determine the sort of final counts associated with each fiscal year. All right, I'll hand it back over to you, Julie.
Thank you. Good to note. I know we get comfortable with language, and so start throwing it out, and it's very important to highlight that differentiation. So we talked a little bit about attachment C previously, the exclusionary criteria. This is here more for reference on this slide. It highlights that the information is in attachment C. So if you're looking about the exclusions and how they're applied, we encourage you to visit attachment C there. Next slide. Also, in attachment C covers the diversion credit and how that is calculated for each of the counties. So if you're curious to know how the calculation is laid out, this section is also in attachment C. Attachment D is entitled Sharing Individualized Records. This is what we refer to as a designated representative. So it explains how to assign a designated representative and how the department will share those individualized records. The biggest questions we have here is, do we have a rep on file, or how can we get one on file? This is the process that counties should follow to add or change or verify if they have a designated representative on file to ensure that they receive our detailed data reports when they're made available. Right now, DSH has about 31 counties, the last I checked, who have designated representatives on file. The reps automatically receive the detailed data reports that are going to include patient names, CIIs, CII numbers, gender, and commitment date to the department. All of the representatives, just in case you're curious, that have been appointed thus far have been from either the behavioral health side of the house or the county administrative or executive office somewhere. So we encourage anyone who hasn't followed this process yet to put a designated rep on file. Please review attachment D. If you need to verify your county's representative, you can always email the team at our global email address, which is dshistgrowthcap@dsh.ca.gov. That's also shared in this slide presentation, so you have it. We can move to the next slide. Attachment E, we talked about this a little bit earlier in the slides, but this is on our dispute process. This attachment is going to outline the timeframes and the requirements for submitting a dispute. The biggest thing here that we've seen so far with a lot of the disputes that have come in is attaching supporting documentation or commitment orders with any records that are seeking to be corrected through this process. So this will outline how to do that and what's required. As a side note, attachment D goes along really nicely with attachment E because that designated representative is going to get a format, which is the template that's required for submitting a dispute. So having someone on file will ensure that you have the appropriate record to submit for your dispute, and it'll help expedite things for you. The next dispute window is going to open on November 1st of this year. And next slide. And then the last attachment here in the FAQ section is attachment F. This specifies how the rate that counties are going to be charged is calculated. The tiers are displayed on this slide for reference. You can find details on how the rate is established and applied in attachment F. And that's it for now. I'm going to pass it over to Chief Deputy Director, Program Services, Chris.
Thank you, Julie. All right, well, let's dip into the expenditure plan, and we'll provide you an overview and walkthrough of the expenditure plan. This first up, what is it? What is the expenditure plan? So I think we mentioned this early on in the slides, is that counties who exceed their IST growth cap and are subject to penalty fees will be required to submit an expenditure plan to the Department of State Hospitals outlining the anticipated use. And I try to highlight anticipated projected use of funds in accordance with the following activities. And these activities are laid out in the statute, WIC 4336. Activities where growth cap funds must be reinvested are in pre-booking activities, post-booking before the IST commitment, and or re-entry services, or a combination of all three. I think there was a question around an example related to pre-booking programs. One really big program that has just sort of launched off the ground, at least in 7 counties, is Care Court. That may be considered a pre-booking program that you can then kind of utilize these funds to help supplement the amount of funds available to operate that program. So just want to highlight that there. Post-booking before IST commitment, again, this is someone has been arrested, they are likely in jail, but the doubt has not necessarily been declared and the court hasn't yet identified or committed the individual as an incompetent to stand trial. There may be a window of opportunity where perhaps the individual's public defender could be searching for a diversion program or some program to divert that person from that IST commitment. That could look in a variety of ways. And then reentry services. So the individual was IST, they've been restored, they've been discharged from a DSH program, and or it could have been a misdemeanor IST and not in a DSH program, maybe a county program. And then after that individual has sort of moved out of the IST commitment, now we're trying to divert that person or engage that person in services to prevent future risk of recidivism and rearrest in the future. So any of those types of activities qualify for investment of your growth cap funds. As mentioned, the expenditure plan is required prior to the department returning growth cap funds to the county. The way that we see those funds being returned is a check that would be issued by the state controller's office back to the county. Plans at a high level should be describing the program or strategy that, as we talked about under these three categories: pre-booking, post-booking, re-entry. So plans should describe the program or strategy that really best meets the needs and goals of the county. And then plans are due anytime after receipt of the invoice, but no later than August. To touch on the template, so we did develop a template to help with the development of the expenditure plan. The template was developed with input from various county representatives. There was a work group that was established to gain their input in the development of this template. The idea was trying to provide examples and a walkthrough to make it as user-friendly as possible. We do have online both a PDF version of the growth cap plan template, expenditure plan template, as well as a Microsoft Word version that can just be used and updated for your county's plan. And then the template, as I mentioned, provides guidance and examples of different strategies that could be employed when planning for your growth cap expenditures. And I'm going to just take a moment. I'm actually going to shift away from this slide, and I'm going to kind of walk us through where you can find it. And so this is this will in live. We're in real time. We're going to go to the DSH website and access the form so that you can follow along. Let me stop this and share my screen. Julie, Denise, can you see this? Okay.
Yes.
So here's our landing page. As Julie mentioned earlier, there's a growth cap link. Just click on that growth cap link. And this is the growth cap page. Our policy is located here. And all those attachments that Julie had walked us through earlier. And then right at the bottom, here are growth cap expenditure plans. I'll open up the PDF template so that you can take a look. And so the template really provides a lot of explanation as to what to do and how to fill out this this plan. And then it also, just to share, and we'll touch on this further along in the slides, is that there are some sample descriptions, program descriptions that help to give you an idea of what we're looking for in terms of the plan. And this is about a total of 8 pages, but most of this is reference. The plan itself is about 3 pages. Okay. Okay. All right. So we walked through the template a bit. Here are the various components of the expenditure plan. All plans should follow these primary components, which are outlined in section 2 of the template. The first 3 here on this slide, the first one being program project title. It's just very high level, 1 sentence or maybe 2, that is just a high level title of what is your program that you are reinvesting these dollars in. The project funds, how much of the funding that's been returned to you is being used to support this program. At a minimum, the dollar amount should match the dollar amount that was reflected on the invoice that was sent to your county. In terms of IST impact, again, this is sort of a high level, just few bullets that really describe what is the estimated number, estimated impact on the number of incompetent to stand trial individuals, expressed through a reduction of felony IST determinations. I put the caveat if known, right? We're asking you to do your best to identify what you think the impact of your program will be on the reduction of IST determinations. And it really should be in this next bullet, it should represent the best estimate that you can provide, and utilizing information that's readily available to you, to your county, in the development of your assumptions. And this section also should identify the strategy that you're applying in accordance with the Welfare and Institutions Code 4336. So is this a pre-booking strategy? Is this a post-booking but pre-IST program? Or is this a re-entry program? In terms of the project scope, we're looking for you to provide us a description of the program in terms of how it's going to operate, who it's going to be serving. If you know the number of individuals to be served, please provide an estimate. It doesn't have to be exact numbers. We're looking for, again, what is your plan? What are you intending to do with these dollars? At the point in which we've got an actual expenditure plan, that's the point where we can true things up. What actually happened when you launched your program and you spent down these dollars? Again, we want to try to identify where within the justice or IST process this is occurring. So if you're familiar with sort of that sequential intercept map, is this something that is very early pre-booking or post-booking pre-IST, again, reentry. So it's just restating what we've said under IST impact. What's your timeline? When you think your project's going to start? Maybe this is an existing program and we are increasing the investment to that program through these dollars. That's okay. You can acknowledge it's an existing program, but when do you think you're going to spend down these dollars? Over the course of a year, maybe 2 years? Let's lay that out. And then try to describe what the funds will be spent on. So for an example, staffing, perhaps you're going to invest in increasing some temporary staffing. Perhaps you are going to spend the funds down on housing or other operating expenditures. Let's lay those things out. In terms of staffing, we'd like to know information about what type of staffing. Is it a social worker? Is the social worker going to support the public defender in identifying individuals who could be diverted from the IST commitment? Give as much detail as you have available. If we have any questions as we're reviewing it, we'll call you up and talk through it and to better understand what you're trying to convey in the plan. In terms of project outcomes, do your best here, describe the impacts that the program will have sort of in general terms, and why you think that why you anticipate this investment in this strategy to be effective, and include any sort of metrics or data that you plan to track, measure, to evaluate the effectiveness of your program. Here's an example. This is a screenshot from lifted right out of the template. There are, as I mentioned, a couple of very specific examples that are in the template. One is for pre-booking and one is post-booking. I mentioned earlier that another pre-booking program could be Care Court. This example here is really seeking to identify and target individuals who could be at risk of IST while they're in the community. And this is giving really just an example of creating a team or some individuals who would then go out to engage individuals who may be at risk based on the criteria that the county is setting up. Here's some just tips and reminders related to the expenditure plan. As I mentioned a few times, the expenditure plan is really for the projected use of the growth cap funds. There will be an actual expenditure report that'll be required in October annually. More information on that is forthcoming. We encourage early submissions of plans, ideally before payment. The county's payment is made to DSH, but no later than August. We ask that the plan represent your county's best estimate in utilization of the funds and utilizing information that is available to you for the development of your assumptions aimed at reducing IST determinations. But as program implementation efforts evolve, we learn new things, we may adjust, we may tweak, and new assumptions or revised assumptions are developed. If that happens, county may just submit revisions to the plan that's on file with the department. That's okay. In terms of our reviewing of the plan, we're really looking to, does the plan make sense? Can we follow it along? Does it meet the requirements that are laid out in welfare and institutions for 336? We are not anticipating an extensive, multi-tiered review process, but we do anticipate some interaction with the counties that are submitting these plans so that we can better understand how it's going to work. But our goal is to provide approval as quickly as possible because we don't want to hold back any funds. We want to return those funds just as quickly as we receive them, really. All right, some additional tips and reminders. All funds, growth cap funds, are not required to be utilized in one fiscal year. So any unused funds that you have that were not spent in a given fiscal year would, from our perspective, could be rolled over to the next fiscal year, and then you can use those funds in subsequent years. But we would have to defer to you, the counties, on how your local spending accounts are established to allow for continuous spending of any unused growth cap funds over multiple years. So wanting to highlight that is that how you take those dollars in is based on how you're setting up your local accounts and sort of what the restrictions or opportunities are there in terms of spending over multiple years. And then actual expenditure reports, again, will be required every year until all funds have been spent. We don't anticipate that reports will be required in this first year, even though we'll be issuing the actual expenditure report requirements in July. And technically this October, reports would be due. If there's no dollars that are being spent yet because the time frame is fairly compressed, we don't anticipate that this year reports will be due, but beginning next year. Okay, now I'm going to hand it over to Julie for just the last couple of slides and to wrap us up.
Thank you. And I see a lot of questions coming into the chat here. I'm not ignoring you. We're just trying to make it through the slides, and we'll see if we can revisit some of these. But as Chris mentioned, these slides will be made available after this presentation, along with the recording. We'll be sure to email everyone when the slides and the recording have been posted online. And if we can't get to your question during this presentation, we will also share questions and answers. We will take some time to put our responses on paper and make sure that they're provided out to everyone. So to wrap up here, the invoices and submission of expenditure plan, the invoices are expected to be released to the county executive or administrator's office, and we're going to CC the county designated representative. I know one of the questions here is, are the impacted counties, the potentially impacted counties, have they been communicated with? The answer is yes. We have designated representatives on file for all 11 of those counties, and we have been in contact with them. Counties can submit completed expenditure plans via email to the DSH Growth Cap team, and our email link is provided there. This is also specified at the bottom of the template. This information can be found there on how to label the subject of the email and then what the body of the email should include. This is just to make it nice and easy so that, as Chris mentioned, we can get those processed timely and get those refunds out as soon as possible. And then looking future forward to the milestones, just to cover what's coming up on May 31st, which is quickly approaching here. It's the estimated date that invoices will be sent out. Also on May 31st will be the progress reports for Q3, and that is for fiscal year 2023-24. So invoices are from last fiscal year. We're still moving forward with the quarterly updates for the current fiscal year. July 1 of 2024 is our anticipated date that we would release the annual report template. Just to reiterate, I know we keep throwing all these report names at you. The annual report is for the actual use of funds for the prior fiscal year. So this is the template for that report. On August 31st would be the Q4 progress reports for fiscal year 23-24. And then on October 31st, it would be the final reconciled data report for fiscal year 23-24.
Thank you, Julie. And then that, as mentioned earlier, the dispute window then kicks off beginning November 1st. So the dispute window would be associated with the fiscal year 23-24 data that is issued in October. So thank you so much. That concludes just our regular slides here, and it looks like we've got some time so we can take some questions. I think some of the questions we may have answered during the course of the presentation, but certainly let's go through some of these. I did get a request about providing copies of the slides, and so I think you all know that we are going to package these up in a PDF format, and we'll email those out for folks and have it posted on our website. We will also have the recording of the webinar posted, but that'll take a little extra time to make sure that we've got the closed captioning available there. How does a county MHP access the funds? The funds, I think, Julie, you mentioned that when we send out the invoices, that it's really directed to the county administrator, county executive's office. They're kind of our main point of contact there in terms of you know, the primary entity for the county where this invoice is going to go to, along with anybody else who has been identified as an authorized representative. By and large, the majority of authorized representatives, in addition to the county administrator's office, are going to fall within county behavioral health. That's the majority of the designated representatives that we've seen on file. But we recommend really that the county as a whole sort of decide as part of this expenditure planning process, really who's going to take lead in spending the dollars down. So if that is, for example, county behavioral health, then the funds are going to need to be accessed by that department in order to spend those down. Julie, you mentioned this, was there prior communication to impacted counties? Yes, we are providing communication just mainly in terms of the progress reports. Those progress reports are tools to assist in monitoring where your IST determination trends in comparison to your baseline. Things do shake out differently throughout the course of the year. We didn't go into this into great depth, but there are a number of adjustments that we do make to the final count, all associated with things like, you know, folks that are participating or IST individuals who may be participating in a DSH program. There are credits and reductions that are applied to the count that then further reduce the number. Those things are fluid throughout the course of the year and then end up getting trued up as part of the final reconciled report that gets issued in October. But we encourage all counties to be really familiar with those progress reports, with the numbers that are on there. And if you ever have questions, you can please, you're encouraged to email this email address that we have here, DSH IST Growth Cap. Julie monitors that, Denise monitors that, they send it to me. We're pretty much the team that will provide you with the appropriate response if you need it. And then we went through where can detailed guidelines for an expenditure plan be found? That's on our website. Is there ever an increase in baseline for population changes? No, not at this time. 21-22 is the baseline. And, you know, we did go through an extensive process where we did engage in several different, with several different county association representatives to talk through our IST determination methodology, which we did end up making adjustments to the methodology and how the final count is determined. That did change from the original information that we had distributed out to counties when we first launched Growth Cap. So there was an extensive engagement process on that. And thank you to Crystal for putting in the link. The baseline numbers were decided when facility, I think this is average daily population numbers, were low because of COVID, which did not reflect true ADP numbers. Is there any plan on reevaluating the baseline numbers? So the numbers aren't just associated with the count of the population in the state hospital system. That is not what the numbers are based on. The IST determination numbers are based on total IST, really referrals and commitments as incompetent to stand trial. And so would encourage going back to the documents that lay out what the methodology is on that. This is a good question. What about incompetent to stand trial individuals ordered to DSH in one fiscal year, but may have been reevaluated 1372 in the next fiscal year? Off the top of my head, I don't remember the process in how we capture that, but we will definitely provide a response back to that question. I just want to make sure that we're giving you as accurate information as possible. For the invoicing related items, can Santa Clara County add our finance staff to the contact list? Yes, we'll definitely send, Santa Clara, we know, has actually several, at least 4 or 5 designated contacts that are going to receive the invoice. But if you want to add some additional people to the email distribution list, we can take that information from you. Just go ahead and email us with that. Can these funds be utilized for JBCT program supplementation? No, not technically. Well, we might have to get back to you on that, but the initial answer is no, because technically JBCT services are delivered at the point in which an individual is incompetent to stand trial. I'm going to say there might be a nuanced situation in which you are someone who is discharging from a JBCT who is now ready to re-enter the community. Maybe there's an opportunity there to supplement the discharge work and the warm handoff to ensure that that individual gets connected to a county program. I think we could consider that. The person who had submitted that question, just reach out to us if you kind of want to talk through some ideas there. We're happy to chat with you on that. Can the funds be used for re-entry for those mental health issues, even if they were never IST? Yes, yes, yes. If we believe that that person could be at risk of IST, then yeah, that would be a legitimate way of applying those dollars. Big difference between before doubt is declared and before found IST. DSH needs to clarify this to be before. Yeah, you're right. Thank you, Clint. I appreciate that. Defense attorneys in many counties declare a doubt early. Yes, I do mean mostly my explanation is really before found IST. That's really the target point there. Confirming the growth cap numbers run from October to October. No, growth cap numbers are associated with the state fiscal year. So they run July 1st through June 30th. There is a cutoff period though. And that cutoff period is we need to have all that information no later than August 31st of basically into the next fiscal year. And that is for, there might be someone who's committed on June 30th and we're not going to get that documentation until maybe August. But once we cut it off on August 31st, really that is the count. The count is the count. What proportion of these dollars is allowable to cover costs associated with the new administrative burden of these proposed programs? That is up to you. If you think that the administrative costs of operating different programs that can be then targeted to help reduce the rate of ISTs, I think that is definitely an investment that we can consider. But again, it's supplementing a program that is intended to in some way be connected to reducing the rate of ISTs. But you got to explain that in the document. Again, if you want to talk through that a little bit more in detail, I'm happy to take your specific questions there. What is the approximate timeline for the refund? So definitely, we've got a maximum 45-day window. In the sort of perfect scenario, if you're a county that is impacted, you're going to receive an invoice. You're going to get 90 days to make that payment. Maybe you stretch it out to that full, 90th day before that payment is made. We hope that your expenditure plan comes to us on the front end. You get the invoice, you're working on that expenditure plan, and you get it to us early so that we can kind of take care of the approvals. And then once that payment is made to us, we know that we've already approved the plan, we're going to just turn right around and within that 45 days issue that check back to the county. And we're set up to do that. Will a copy of this PowerPoint be available? Yes, it will. Will proposed expenditure plan require County Board of Supervisors approval? No. We don't require County Board of Supervisors approval. If that is a requirement internally that is set by the county, though, that is not something that we're going to prevent. But we don't require that. Can you explain, why you're using IST determination as part of the count against the cap and not commitment? We define determination specifically to really be IST commitments, but the statute describes it as IST determination, but really for purposes of the growth cap, when you look at the definition, it is one-for-one associated with an actual IST commitment and ultimately referral to the Department of State Hospitals.
And Chris, I know you've gotten through a lot of these questions. I just, in respect of time, I know we're pushing up to 12:30, so just wanted to alert you to that.
Thank you. Thank you. There's just a couple extra questions here. Looks like we've addressed the commitment. For the fines issued this month, what year data count is that for? Yeah, it's for 22-23 data. So we've really kind of extended the timeline out for a really long time because this is our first year of implementation, and working through all of the questions and the issues that have come out. And yes, Rick. So since CONREP is a DSH contracted program, will ISTs committed to CONREP be counted against the cap? Yes, that is correct. Those are referrals. Those are commitments that we do receive in the Department of State Hospitals, so they would be included in the total count. And then Nelson, looks like you've got a pretty nuanced question. We'll take that back and put together a response for you on your question. I think that captures it mostly. Anything we didn't get to, we will provide a response in writing and put together a Q&A document. If you got any other questions that you think of after the end of this presentation, feel free to just email us. I've got the email address up on the screen, and we'd be happy to respond to you. If you want to talk through anything, we do meet with counties. We have met with several counties and representatives and individuals that are tasked with having to put together or track the growth cap. We're happy to meet with you as well. So just give us an email and we will schedule something with you. All right, guys. Well, thanks so much for joining us today, and we will see you next time. Take care.